Hi, you've been scheduled for a procedure called a neck dissection. A neck dissection is traditionally a surgery that is removing of the lymph nodes on one side of your neck as it relates to some sort of cancer spread. This surgery takes approximately between 1 to 1.5 hours to do, but in rare cases can take longer, even 2 or 2.5 hours to do. It involves a 4 to 5 centimeter incision that extends on the side of your neck in a hockey stick shape formation. The surgery involves making a skin incision and extending the incision down into the deep parts of the neck to remove the lymph nodes. The surgery has some inherent risks to it. Those risks include, number one, injury to local parts of your body. That includes nerves. So there's certain nerves that can be injured during the surgery. Number one is called the hypoglossal nerve. This is the nerve that innervates your tongue. If that were to become injured during surgery, it could make your tongue paralyzed. That could affect your speech or even your ability to swallow. The second potential nerve that could be injured is called the spinal accessory nerve. This is a nerve that innervates your shoulder and allows you to raise your arm above your head and also to move your shoulder. There are some other nerves that run in that general area called the spinal nerve rootlets. If these were to become injured, it could result in problems with innervation to your diaphragm and also issues with swallowing. There's also the last nerve is called the vagus nerve. This is the nerve that innervates lots of organs in your body, but most particularly can cause issues with your voice and also with swallowing. Injury to any one of these nerves is extremely rare during this procedure. Instances of this happening while I'm performing the surgery occur less than 1% of the time. However, it's important that I discuss them with you. The second potential risk is injury to local vessels that are in the neck. Those two major vessels are the carotid artery and the jugular vein. If the jugular vein was injured during surgery, it could result in extensive bleeding that could occur very quickly. Most of the time this can be managed and the jugular vein can be repaired or ligated. A second injury to a vessel that could occur is the carotid artery. If the carotid artery was injured, that could be devastating, resulting in a stroke potentially. Again, both of these are very rare complications. However, it's important that I discuss them with you. Another risk that can occur during surgeries is something called a hematoma. After surgery and your incision is closed, you can develop bleeding or fluid collection in your neck. If this were to recur, it could occur rapidly or slowly. If it were to occur rapidly, we'd recommend you go to the emergency room very quickly and call us while en route. If it were to occur slowly, we recommend you call us, but oftentimes it involves evacuation of any fluid that could have accumulated. After surgery, you may need to have a drain placed in your neck. This drain would remain for approximately 24 to 48 hours while it collected any fluid that may occur. The last potential injury or complication that could occur is infection. Because this is an open wound, sometimes infections can occur. If it were to occur, sometimes these are treated with just antibiotics, but in rare cases, they may require an incision and drainage of any pus. The vast majority of patients who undergo neck dissection have a very uncomplicated recovery period. You will indeed have some postoperative pain and potentially nausea, and you will be prescribed pain medication and nausea medication for after surgery. Thank you.
This video is presented for general information purposes only. No attempt is made to include all significant risks and benefits of surgical procedure and may not apply to a particular patient. Review with your physician any questions before signing the informed consent form.